DBS is obviously invasive and it's brain surgery. Can you maybe talk about the steps from consultation and when you're evaluating to the recovery aspect of what DBS entails?
So you're going to be referred to my office from Dr. Legg's office. At your initial consultation appointment, we're going to talk about what symptoms respond best to dopamine. And I'm going to counsel you on, what I think DBS can help with your Parkinson's disease, and similarly, what I think DBS may not help with your Parkinson's disease. And hopefully Dr. Legg has already talked to you about that also. In people who are going to get subthalamic nucleus stimulation, I refer for neuropsychiatric evaluation. That's to make sure that you don't have any underlying dementia or psychiatric illness that may be made worse with stimulation. Then we will get a set of labs and brain images to make sure that your brain is safe to undergo DBS surgery. It's extremely rare that you do not pass that step. And then we will schedule your surgery after that. If you have a cardiologist, you'll have to get clearance, and if you have significant medical issues, you'll have to get clearances for that. On the day of surgery, you'll come in to the hospital, you'll meet the team, you'll be awake during surgery most likely, and that's so that we can test your lead and make sure it has efficacy. We kind of give you the same medication as if you were having a colonoscopy. So everybody who's luckily had a colonoscopy knows you kind of remember it, you kind of don't, and you wake up and you kind of remember some details, and that's kind of how DBS surgery is. So we give you the colonoscopy medication. We put some bone screws in your head and train a computer where in space your brain is. And then we do a series of recordings to see and check that we are in the correct place before inserting the final wire. We also do a series of checks to make sure that you don't have any side effects where we're going to put the wire. We put the wire in, we test it again, we make sure that everything works to your liking and to the company. The lead company is also in the room, and they make sure that you have a good threshold and everything. And then we put you to sleep and we close everything up. Because of the way insurance companies pay for these surgeries, it has to be done in 2 stages. So the first stage is we put the wires in the head. The second stage is 3 days to a week later, where we connect the wires to a battery that goes in the chest. That is a great insurance question, which I still do not to this day understand why. Basically, the battery is the most expensive part of the procedure. And if they don't bill it separately, the hospital doesn't get paid for the battery, and they lose money on the surgery. So it's basically standard of care that these are done in 2 surgeries, which is unfortunate, but that's my soapbox. So the second surgery is general anesthesia. You go totally asleep. It's a 30-minute surgery. We connect the wires from here. We tunnel it underneath your skin to a battery in your chest. If you've seen people with pacemakers, it looks exactly like that. After that surgery, you'll see me in my office in 2 weeks. We'll check your incisions, and then Dr. Legg will see you 1 month after surgery, after your leads were implanted, to do your initial programming. Programming takes anywhere from 3 to 6 months, depends on how long you've had your symptoms before, how tricky your tremor can be, things of that nature. But you work with Dr. Legg closely, and Dr. Legg and I keep in close contact.